Afternoon. As we continue to fight the virus together, it's clear that while we've taken a lot of steps across the Commonwealth to protect residents of nursing homes and staff that works in nursing homes, we need to offer them more help. So as the governor said, residents that live in these facilities are often among the most vulnerable to the virus due to their age or health conditions they might have. And on top of that, social distancing is pretty difficult to achieve in a congregate care living situation or facility. And we also know that staff that work in these facilities often work in multiple facilities. And I do want to take a note to just acknowledge those staff and the healthcare providers that work in those facilities. Even on the best of days, they provide compassionate care to the people we love the most, our parents, our grandparents, and right now they're doing that under incredibly challenging circumstances. So acknowledging that, we're very committed to making sure these facilities continue to get the funding they need and the supplies they need to protect the people that live there and to protect themselves and their staff. We also want to ensure open communication between our local health departments and these facilities in a given area. The task force that I'll be honored to work with are also committed to ensuring that facilities and the public have the most up-to-date information possible. This includes data on the proportion of facilities that have had a positive case among residents or staff, and sadly, we will also be providing data on deaths in long-term care facilities. Some outbreak data is already available on our website. I will provide a couple data points right now. As of today, we have counted 45 outbreaks in long-term care facilities out of a total of 82 total outbreaks in the Commonwealth. That's about 55%. And in addition, as of today, in our outbreak database, we have 525 reported cases. That represents approximately 10% of all cases, and 32 deaths, or about 25% of reported deaths among residents and staff. I do want to explain a little bit the number there. That 525 comes from an outbreaks database system, which is different than our disease surveillance system that produces the case counts that you see on the website every day. We are working to build out some functionality in the disease surveillance system so we can pull this data from that. That's going to take a little bit of time. So in the interim, we're pulling data from this outbreak system. So the numbers may not always match, but we have pretty good confidence in that number that I'm providing today. And we're building additional tools to track these data, and those will be available probably late next week or early the following week. The task force will help ensure that we're coordinating with our facilities to get them the help and the supplies and information they need to protect the people that live there. And I look forward to working with a lot of colleagues and partners in that work. Thanks.